Well, Mark, today the province released new modeling that focused on COVID variants. It found they will likely be 40% of all new cases by the second week of March. In short, we could have a much better summer this year, it finds, or we could have a third wave. Dr. Steiny Brown, who's on the COVID science advisory table, is calling the situation a minefield.
Cases will likely explode if the virus gets into conditions that create super spreader events. Simply, we need to watch our every step.
While there is good news, like a decline in long-term care deaths, there is some evidence the post-holiday drop in COVID cases in the province may now be stalling or even going backwards. Declines in cases, hospitalizations, and ICU occupancy are slowing and are, in fact, expected to soon increase. This graph shows if variants get out of control, Ontario could see 4,000 cases a day by the end of March. If controlled, the province could have only 500 or so. The report also finds the pandemic is likely to recede in the summer. In the meantime, it recommends loosening restrictions very carefully.
Only care and caution will protect the gains that we have right now.
Of course, vaccinations are key, especially getting them to the most vulnerable. The Ford government has been taking a lot of heat after revealing its vaccination timeline yesterday. Its online booking portal won't be ready until March 15th, weeks behind Quebec and Alberta. And it won't start vaccinating people 75 and over until April 15th. While in Alberta, that's beginning now.
We don't want to rush to failure.
Health Minister Christine Elliott defended the government's plan, saying it can move faster if the federal government delivers more vaccines. The government also confirmed if public health units have vaccinated all Phase 1 recipients, like long-term care residents, they can start vaccinating older people sooner. Now, Ottawa, for example, will begin vaccinating those who are 80 and over in high-risk communities starting next week. Now, I want to tell you about the Chief Medical Officer's testimony before the Long-Term Care Commission. The transcripts were released today, and he's being heavily criticized for some statements. For example, while acknowledging fast testing was critical for long-term care residents, results were mailed to the homes because of a lack of technology. Dr. Williams says he did not raise that as an issue. And he also said he did not believe there was asymptomatic spread until late summer. The Ford government did a data dump just a couple of days before his testimony, sending the commission over 217,000 documents, which of course would be impossible to read.